I am what's called a de novo case, which happens about 20% of the time. It's a mutation of the VHL gene, which is a tumor suppressor. So my body no longer suppresses the growth of tumors. And actually it affects 10 different parts of my body. So it's a big deal because you have to get screens for all those different parts. So it's the eyes and the ears and the brain and the spine and the pancreas and the adrenal glands and the kidney and the reproductive organs. And now they're finding out that it also has some potential impact on the lungs. So lots of different parts of the body. I was given a stage 4 diagnosis, and I made the mistake of asking how long I had to live, and I was told, 2 outside 3 years, and it's been almost 3 years, and I'm nowhere close to dying. So I think I'm an outlier, and I think choices I've made about how I live my life and how I view my cancer they've really made a difference in my survival. I have to tell you, Mayo Clinic has been so responsive to every single thing I've requested. They've become a clinical care center for VHL at my request. They completed a very rigorous process to find doctors to handle each of the different elements of VHL, all those different body parts. I know that if I approach this positively, if I am committed to taking care of myself and controlling those things I can control, but leaving it to the experts to help me with the things that are totally beyond my control, that I will live a much longer life and a much better quality of life. And that's one of my compliments about Mayo, is that we had that conversation. I had that with both my oncologists. I have a neuro-oncologist that does my head up, and I have a regular oncologist who does the rest of my body. And we all agreed early on that quality of life was more important than length of life. I think there have been as many positive things to come from this experience as there have been negative. I try very hard to have some joy, and pretty much I can have joy every day. I am really excited about the future, and I expect great things to happen.
What inspires me with you and other people like you is that when I come to work every day, I get to participate in the care of a person who thrives because of the attention that either I bring to bear or that I can get the larger system to bring to bear to help you. And it's a tremendous advantage to somebody like me practicing in a place like this to be able to walk down the hall and there's an expert for that problem, there's an expert for that problem, there's an expert for that problem. It doesn't get any better than this in medical practice, honestly, to be able to be so wired in. I don't have to know any of this stuff, but if I know who knows, I can get you cared for.
Right.
And that's a huge advantage that I get to experience every day, and I know that my patients get to experience it.
I think what you just described is absolutely true, that every single thing I needed, you provided, and you were flexible about it. And we talked about even which doctors, you may not remember this, but I certainly do, which professionals would be the best fit for the kind of personality I have. Because, I can be a little pushy sometimes. And so, some people are fine with that, and some people are not so fine with that. So you set me up with folks who really were comfortable and willing to sort of co-create what my plan of care was going to be. I'm delighted that I got to see you. Because it's not even, you just, you say, yes, that's part of your role, but actually, you have a whole different role. But you choose to be there for people like me who are the strange cases and the oddballs who have genetic issues. And I'm just always going to be grateful to you for that. Thank you.